disconnected. Okay. So we just want to go that really quick, pretty simple. That phone number, I'm going to get the PowerPoint. That way everybody will have it with our resources. And then all you need to do is call that number and do essentially set up an appointment for them. It should only take maybe about 2 or 3 minutes. And it doesn't matter if they show up to the appointment or not. You will get paid the $150. They're doing it on a monthly basis, so it's money that you can make while we're enrolling people for AEP. So definitely it is a really good situation.
How does that hit us? Is that from Cornerstone and direct deposit, or how does that work?
Yes. So monthly, they're going to send money to Cornerstone, and who's supposed to get what? And so it's not going to be charged backable. So it's a new word. I like that. I like it. So definitely, once you get that money, that's money that can't ever be taken away. Kind of like doing the HRAs. Hopefully, everybody you enroll during the AEP, you do an HRA with them, the health risk assessments, because those also cannot be charged back. And so that's all money that's just in your pocket that won't go away, which is great. And the HRAs and the Centerwell stuff is money that's going to be paid out now. So you don't have to wait until January to get the big check, so it's really good. John's getting ready to, before I do this, there's 2 new incentives going out. I think we'll see still a couple more. This one's with Medico. Medico just came out. I know they had the hospital or their med subs. If you rate 3 or more med subs between, I think it was 10-1 and 12-31, you get $150 per med sub. So that's quite a bit, that's another big bonus there. They're now doing it with their hospital indemnity plans too. So we'll talk a little bit about the hospital indemnities today too, but if you rate at least 3 or more, you get an extra $25 per hospital indemnity. So UNL's having a contest, Medico's having a contest, so I would definitely look at the companies that are doing contests, because that's free money. Free money is going to come your way, and I like getting all the bonuses that are out there. Be that as it may, Cheryl made these charts look very nice this year.
Pretty good, Cheryl.
These are being emailed to you as we're here. I just sent them to John. He's kind of compiling it. We'll get that PowerPoint and put it in there. But these, if you want to print them out, you can on your own. I would suggest printing them in color. Because you print that in black and white, it's going to be really hard to read some of these colors. I am not going to actually print it myself. I am going to put it right onto the iPad, onto your front window. You can click your button and open it up very nice and easy. Obviously, this one here is the Blue Cross. The Blue Cross is fairly simple. They've only got a couple of different plans there. I do think it's going to be pretty popular this year. They do have a 0 premium plan down here now, which is great. What Blue Cross, if you kind of look at it and say, why would I want to rank that? Well, obviously, it's local. Everybody you call, when you call Blue Cross, you're calling Columbia, South Carolina. So that's kind of cool that, customer service-wise, you're not getting somebody over in California or over in the Midwest or a different country. You're getting somebody from Columbia, South Carolina. So a lot of people do like that. They like the name Blue Cross. They also do something a little bit different on their copays. They have what they call an all-inclusive copay. So if you go to a doctor or a specialist and you have blood drawn there, you have an x-ray, that's all inclusive in that copay that you paid in the very beginning, which is pretty cool. So I would definitely look at it. I'm not going to go over every single plan because most people have already come in and talked about it, and you can kind of see the plans. Obviously, they've got the upstate plans, the Midlands, and then the Low Country. In the Low Country, you essentially have 2 PPOs. One has a premium, one doesn't, and then an MA only PPO. Obviously, the MA only PPOs are the ones that we're using mostly for veterans, people who don't need drug coverage, because you cannot have an MA and a separate Part D plan. So it's mainly for veterans or somebody that doesn't need that kind of coverage. On here, we're going to have all the different cares. There is United Healthcare. They do have a few other plans that are on there. I wanted to mention it because we've run into it, and we had another big discussion today. You know, be careful with people that have silver plans and don't have Medicaid. That really puts people in a bad situation. They will allow you to enroll in a plan in silver without Medicaid, but you're really essentially enrolling somebody back into original Medicare with even higher copays going into the hospital. So you want to be careful of that, so I'll just kind of mention that. They are color-coded this year. So Cheryl did a pretty nice job putting the colors on there so you know which books. So it makes it easier when you get your books to grab the colors. They all seem to make sense. You know, the gold's not gold, and they don't quite get what they did, but you know, be it as it may. I do think the PPO plan and the HMO2 are two of the more popular plans on that. They do have a plan to PPO for somebody with LAS extra help. I did put in this email you're going to get all the LAS extra help charts, so you can have that right on there on your iPad again. You put it into a folder, it's all sitting right there. If somebody's on 50% LAS, you can see exactly what that premium would be. So it makes it nice and easy. WellCare, the same thing. I know right now a lot of the WellCare books, I'm trying to get more in here. I know a lot of them have been back ordered. A lot of people have said they haven't got their WellCare books yet. So I am working on that. Hopefully by Friday I'll have some more books. But they've got a no premium HMO, which is really popular, and I think the Get Back plan would be really popular, and they're dual. So they have a couple of plans I think will be popular again this year. Aetna was, I think, our most popular plan last year. I think we wrote more Aetna than anybody else. So that is definitely going to be a popular plan again. He was just here, so I'm not going to go over that. There are all the LAS premium charts, so again, it makes it nice and easy to look at and figure out where the LASs are for your extra health plans. And then, of course, enrolling. Most people know what lean is. They know where United Healthcare is. I changed my password there, so I'm not even doing it. But Medicare Center, has everybody been using Medicare Center pretty well? I use Medicare Center to try to figure out what plan I am going to use almost every time. Do I ever use it to enroll people? I do use it for my Humana enrollments and my PDP enrollments. So if your Medicare Center is not looking like this, this is the new Medicare Center. You got to make sure that you have the new link. John has sent it out like 3 times. I know ASP has sent it out. You want to make sure that you're on the newer plans, because as of Friday, I think they're going to turn off the old plan. But the new plans are really nice and easy. On the new plans, you can add medications in, so that the medications will be searched in the medication box. You can also add doctors in. So it's really easy, and you can look at 2 different ways of look at lists and just compare them. So if you want to compare, in this case, the WellCare PPO is who she was already enrolled in, and if you want to compare it next to the AEP PPO, you can do that, look side by side. This is also something you can send to your clients. I'm doing a lot of enrollments over the phone, and so I can get all the details and send it to my clients, and we can kind of look at it together and discuss it. So the compare feature is really nice. It also gives the detail on the drug costs, and if the client says, yeah, I do like that, if you wanted to, you could enroll through there. Now, I am not enrolling mainly through the Medicare Center, only because I want to be able to get the HRAs, and the HRAs are not attached to the Medicare Center. I think next year they're going to be, but they're not as of this year. So where you want to enroll if you want to get your HRAs is obviously United Healthcare. You need to do it through Lean, and I think everybody has Lean and knows how to enroll through Lean. If you don't, please come see me. I do use this for the Humanas because it is pretty simple. You can send them a link where they can electronically sign. You can do scope appointments right through there. They can electronically sign or sign right on your finger on the tablet. Aetna, I don't know if you all had a chance to pull up their new one this year. You can still do Ascend, or you can do this new one called Think Agent. So hopefully everyone downloaded the Think Agent and have actually signed up on it. It looks like it's going to be pretty simple, except for the login time of pulling it up. There we go. I don't know where to save it. There we go. Well, when you go into Think Agent, this is new this year, so that's why I wanted to pull it up. When you go into Think Agent, you can go in there, and right there is where you can do an HRA. You can do actual sales. So you go in there, you can pull your report up. You can actually look at and see what plans are out there. The providers right on there, so it's got everything that's right there. It makes it kind of pretty easy to do.
Is there a scope on there too?
Should be. There's an e-kit that you can send to them, which was great. I didn't do the scope yet. It's probably gonna be in the enrollments. But I went on there just trying to find the plans. You go in and put your zip code. And the plans come right up. So in Dorchester County, there's essentially 2 plans. You can compare them. And again, at this point, you probably have already compared to actually look at it and see if this is the plan that you want to do or not. But you can look at them right next to each other. Want to enroll?
Yeah. Let's see if the scope comes up.
No, you have to lead in there first. They have not put a lead in yet. I think I just do zip code. Shot it, I hear you. Okay. State is required, okay. You're the zip code, you're the state, right? Here we go. Yeah, I guess it doesn't go the scope on there. I have not enrolled anybody on it since it was brand new when he just told us the other week. Don't need to be a camera. So no, I do not see the scope there, so I need to find out. No, it's not going to scope there. So yes, that is odd. I need to find out about that. But I will find out. Again, this is a brand new software on a Think Agent. We'll definitely get in there and see resources. Alright, so I need to find out about that. Again, if you don't want to use that, you can still use the Ascend. Most of you that enrolled last year have used Ascend before. So you can definitely go in and use Ascend. That will still be there. You should still have in your leads from last year too. So if somebody was in one of the plans, you want to go back in there and change them to a second plan that's in there, the Ascend is going to be there. But beyond that, you definitely want to make sure that we're taking advantage of the home health cares. While you're there, again, it's all electronic, so easy to do. You might as well go over and make sure that the home health care or the hospital indemnity really should compare with almost every MA you have out there. If you don't, somebody with these 0 premium MAs, and you're not at least giving them a $25 or $20 hospital indemnity, then you're really putting them in a position that they're gonna end up with a lot of money out of the pocket. And so, you know, home health care has been very popular, and hopefully you will use the home health care. You know, I'm going back this year, a lot of my home health care is reminding them to give their prescription list to me and sending it in, and they're getting money back. Now they're seeing the value, and they're protected on the home health care side, which is great. So definitely want to stay on top of that, but even if they said they can't afford the $650 or $60, $70 a month, at least get a hospital indemnity in there to show them, you know, obviously when you're looking at all the different plans, you can show them the inpatient hospital. So they're looking at the HMO plan 1, it's $325 a day for 6 days. You look at that, somebody goes in for a week, they're looking at about $2,000 out of the pocket. I'm pretty sure most people wouldn't mind paying $25 a month to make sure they don't have to come out of pocket with $2,000. So, hospital indemnity plans, if you present them the correct way, you'll get a sale almost every single time. And again, it usually adds an extra $100 or so to your Medicares, and now if you've helped them, you'll get the appointment for the going to the center well, they've done an HRA, and you get a hospital indemnity, you're looking at about $300 extra onto that Medicare sale. And so it makes it's worth spending a few extra minutes to make sure that they are protected very well. I've had many people this year say no one's ever sat down and actually taken the time to explain those things, or even looking at those medications to make sure medications are protected best against that product. But it's very simple to do. And if you don't, I mean, I had a client the other day who was taking a medication that is costing her $100 a month. We took her from her plan that she was in Humana over to United Healthcare, and that medication was $0. And so it just happened to be an expensive medication from one plan to another, but no one sat down with her and showed her that it was $0. Just saved her $100 a month. I'm pretty sure she could afford a health care plan at that point. She was already paying $100 a month for that medication anyway. So, you know, taking the time, sitting down with people and going over it are really going to help you in that. A lot of people just blindly say, oh yeah, I want to enroll somebody in United Healthcare and have 100 United Healthcares. But you really want to take the time and make sure, putting them into the Medicare Center, putting all their prescription drugs in there, putting their doctors in there, and that will keep you from getting complaints and putting people in a plan that's not best for them. What you got?
Don't worry about it, keep going.
Is anybody having any problems with the Medicare Center, or doesn't know how it's worked, or how to put a lead into it? Is everyone using, yeah, Sam?
Can you, you might have answered this already and I missed it, but can you import the ones you had from last year into this year?
On the Medicare Center?
Yeah,
They should already be there.
I don't there, that's why I'm asking.
When you go into the Medicare Center, yes,
Yeah, but if you put somebody in the Medicare app instead of the first spot, see it says Medicare app?
right.
The other says Medicare link. If you put one in the app, it's not in the link and vice versa.
I didn't
Pick
think
one
we should have-
and use it religiously.
Yeah, there are 3 different buckets in here. Some people do like the Medicare app. I like the Medicare link better. There's no right or wrong way. I thought it was just easier on the medications and the doctors to put it into the link, or maybe it's what it's got used to. But are you saying because you used the other one this last year, Sam?
Yeah, I'm saying that I used the other one, last year, and I don't see any of mine from last year that rolled over or anything. Let me see.
Alright, so,
Okay, that's me, that's where I was testing. No,
Sam,
huh?
come see me, I'll show you.
Okay, thank you.
yeah, I was gonna say,
Yeah, that's me, that's not.
okay. Well, I like the Medicare Center side of it, the second one, I like a little bit better. Again, maybe it's just me, but it's easy to come in and to add a brand new contact, ask some information. Once you have all the information in, it is really easy to add medications and doctors and to compare side by side. But and that's the reason why I like it. I can send it to somebody, they get a little link, and they can enroll. I have used the other side, Sam, but I use the other side on the website because it does have your own personal link that you can send to somebody, and they can compare plans and then enroll themselves. I just don't know how many people are actually doing that right now. I've sent it to a couple people, but not too many people are gonna wanna get a link and do the research themselves. So, and that's the reason why I liked this side of it. Again, it does show, I will tell you that the doctors are not always correct. So like on this very first one, it says Humana, those two doctors are not in the network. I a lot of times will pull up and go over to the doctors accepting networks and go down and search on the carrier site, which will take you over to Humana to search it. I double check it. I know it's extra work, I know it's a time thing, but
Where did you go? You got this, we can't see where you're going.
okay. So if you are on where it says Humana,
Yep.
and those doctors have X's next to them, you go down where it says, okay, doctors accepting patients, it'll open up the doctors, but right down here it says search doctors on carrier site. So you click on that, it'll automatically take you over to the carrier, then you can go, it should get right to the doctor's side of that. So you can just quickly put in the doctor, dentist, whatever it is, and search it on there. I like to double check and make sure that they're actually in the network. Not that I don't trust anything, but I trust the carrier site more than I do the third party site. So I almost always go and check over there. But I do like the third party site because you can compare two different companies. You can compare Humana to United Healthcare to a WellCare and look at all the plans right next to each other. So if this client had that Humana and they wanted to compare with the Aetna plan and the AEP plan, now obviously on there, it would not have worked. Well, shoot. I couldn't sum up. Alright, so when you compare that one with the Humana one and with the WellCare one, you can compare all three of them side by side and actually look at the monthly premium, go down in between all the plans and compare line item by line item. And a lot of times you're only really looking at two different plans because the medications and doctors, you're not looking at a lot of plans, but once you start going through it, somebody may say, oh yeah, I wanted the extra dental on that one plan. Okay, well now you found out what's really important to them. And the other thing I do like about the Medicare link is it saves everything in there from one year to another. So all the medications are in there, all the doctors are in there. So when I'm doing a review, that's why I'm doing a lot of phone reviews right now. Because when I'm doing a review, I can pull right up, hey, has the medications changed at all? Oh no, I'm not taking lisinopril anymore, I'm taking metoprolol. And you can quickly change that, update the list, and you've got everything. You've also got all the medications that you need to apply for life insurance or a different product. You've got everything in there. So I'm all about data capturing. If you do data capture, it's a little bit easier going forward to next year. And I'm just trying to be smarter as we get older and not travel as much as we don't have to. A lot of my clients I've seen 5 or 6 times, I'm doing over the phone right now. And people have been really, really receptive with it this year. I'm pretty happy about that. So, I mean, that's really, honestly, without going over all the plans again, because most of the carriers have been out here and done that. Does anybody else have any kind of problems or questions that we need to kind of go over? We need to make it kind of short and sweet today, less than an hour.
Did you say the Blue Cross Blue Shield is gonna load it into this?
Into the Medicare Center?
Check this one.
Yeah, okay, so that's a good point. Let me see how I did that again. So she asked about Blue Cross Blue Shield and the Medicare Center. If you go in there, let's see here. I showed you how to do it the other day.
Yeah, you're not gonna be able to see it now, because you're already fresh. You have to see it first.
Okay, so yeah,
See it, Bob?
such.
No, it does not. So right now, they're still letting all the plans in there, but I went on the side and picked Blue Cross Blue Shield. It didn't come up. If you put reset the plan filters, it should show up. There's also another one that you see the very bottom too, on the bottom left-hand side, you can put appointed plans only. You can unclick the appointed plans only, and now I can see Clover on there that I didn't see before. So even though I'm not licensed with them, I can still compare next to them and see the benefits. But then Blue Cross should be on there. Let's see. Yeah, there's the Blue Cross. So then you can compare Blue Cross with the WellCare. So you just have to refresh that. They also said they're still working through a couple of the plans, so if for some reason you want to see Blue Cross on there, it doesn't show up that time, just push refresh on that, it should show up there. And hopefully that will take care of it. I don't know if you can refresh on every single one you do.
Does it look like it's working on the app? Yeah, I gotta use the app, because last year the link wouldn't work for me, because of my name. And so I'm using the app.
On the app?
Yeah. Blue Cross Blue Shield, not all, so she's on the app, like the Spectre app. It's my last name, Matt. Dwyer.
Are you licensed with Blue Cross now?
Yeah. I've been there since.
Let me look on the app, see if it's on my app.
Scott, you mentioned doing on the Medicare Center, do Humana, said UHC do on lead, Aetna do on Center, Tech Agent, or the other, or WellCare, what are Blue Cross, what are they doing those?
Okay. So WellCare is still on. Hold on, just pull one up here. WellCare is still on Ascend.
Blue Cross you just do on the Medicare Center, right?
Yeah.
Because they don't have a, they don't have
Blue Cross does not have an HRA, so yeah, you can do Blue Cross right in the Medicare Center. Humana's HRA is on their homepage, like I showed you all the other day. So that's why I don't mind doing that through the Medicare Center. It's quicker in the Medicare Center. No, it's not over there on mine either. Just a regular Humana page, humana.com. I'll show you that too. There's also a third link over here to the CSG app. That takes you to your own CSG. So some people like to use the CSG to quote different things, or that's also in the Medicare Center now, so that was new. So they're working on getting it. So if you push the CSG, it's going to take you over to your own CSG page. Okay. And then there's your CSG.
Mine does not. I'm sure it's user error.
It takes a minute if you've never done it. The first time it takes a minute to go over there. Say Gary, if you go on to just humana.com, Gary was asking where the health assessments were on Humana. If you just log into your humana.com site as an agent, and right halfway down the middle, that third column is member care assessment. So if you go to the member care assessment, it
The,
takes you over to the Revel.
the electronic scope of sales, the scope that's on the CSG, will that be, that can go for anybody?
You can use a scope there, you can use a scope on the Medicare link. I use the Medicare link all the time because on the Medicare link scope, you can send it via text, you can send it via email, or you can sign right there. So it kind of gives you all the options of that. To me, it's an easy scope. Let's see where my Medicare Center goes.
So is that what you use for Aetna in the meantime?
Aetna?
It's not on Tech Agent?
The scope? Yeah, you can do the scope anywhere. I don't like paper scopes anymore. I like the electronic scope. especially because they don't even ask for the scope anymore, you just have to keep it for 10 years. Might as well do it electronically. If not, you gotta upload it to your Mac system in paper. That's the easier way. But if I'm going to lien, I'll do it through lien. But if not, I'll do it through Medicare Center almost every time. Because once you get to Medicare Center, right to the very top, third box over, is scope. You can click on the scope. You can email, text, or complete the scope right there. So it makes it really easy. If you want to complete it, that's all it is. They sign and they're good to go.
Scott, if you do spike through the send, you have to scope on that, or can that,
You can do the scope anywhere.
you might have to transfer it over to the send again?
Nope. It doesn't matter. Now, if I'm on one of like Ascend where it's really easy to do the scope right there, I'll probably just do it because I'm already logged into the Ascend. But let's say you meet with somebody or you talk to them on the phone and you want to send them a scope, you can just go to Medicare Center, text it to them or email it right to them. It's quicker and easier. Even if you're at a function and you're sitting there at a CVS and you need to pull up the scope right there, they can sign with their finger. Good to go. So the Medicare Center I think is pretty easy on the Medicare link to do scopes. Again, it keeps it all there. So if you need to go find it later on, it's still going to be there. I just think it's pretty easy. That's what I use the Medicare link more than anything else that I use right now. Again, not right or wrong, just a comfort thing. And because I can take it and compare it and send it right to clients, and they can take a look at it. So beyond that, anybody else have any other questions or?
Yeah, that's a generic scope though, but when you go into the company-specific apps, for the e-apps, those are company-specific scopes.
It doesn't matter.
I'm just saying, there's a difference.
It is. I mean, you can go onto Ascend and do the scope right on Ascend and then do an enrollment. So what I'm saying is, you don't know a lot of times, what if you're somewhere and you're not doing an enrollment that time, you might as well get the scope done. So later on, if you're gonna send out, because I'm doing a lot of enrollments over the phone, and so if I would do it over the phone, I could use the regular scope and then send them where they can go and sign up. Or you can do everything for them except for the e-signature. The scopes don't matter. You can have generic, they haven't mattered for years. As long as you got a scope and you can keep it for 10 years in case you ever get, in case you get a complaint, you just need to show that you had a scope appointment done. So you just gotta stay compliant with that. And it's not hard to stay compliant, especially now they're not doing a lot of seminars and stuff, so it's not very, very difficult. But that's pretty much it. You guys should have all the other tools will be in your email. Again, I'll put it on my iPad. If you want, you can print it out yourself in color and laminate it. I did see a few people were laminating them already, so that's good. But it's a nice guide to make sure you've got everything ready to go for Friday. So nothing else?
I would just say one thing, guys, this is 15 years of these MA seasons, just work smart. I've seen people over the years, their first couple of years, running 3 appointments a day, 5 days a week, and you get burnt out real quick. So if you have to work Tuesday, Friday appointments, then fine, but use it as a pit stop to kind of like recharge, book your days and kind of like maintain through it. But if you're gonna work these days, you're better off stacking appointments for one long day in Walterboro instead of going out there 2 different days at 3-4 appointments each and getting burnt out. So just be smart with your time, especially because we don't get paid on these things for another month or two. So.
Yeah.
Would you do a fast and dirty on
On the work.
Yeah, well, a quick and easy on how, making over the phone. Okay? Doing it over the phone.
Okay. Well, I mean, my process, if I talk to somebody and I know they already have a Medicare Advantage plan. Let's say somebody called me or somebody referred somebody to me. I get referred a lot of people out of town. And so somebody may call me and say, I'm in Georgia You know, my sister lives in Orangeburg and thinks the world of you, and I want you to help me with a Medicare plan, and I don't like my plan. Okay. So I try to find out first what you don't like about the plan. Oh, my copay is special is too high. Okay. Or I don't like that I can't use my dental, or whatever they don't like, or my prescription's too high. You know, that lady I had earlier. So at that point, what I do is I tell them, I need to get a list of your prescriptions. I said I can do one of two things. I've got a link I can send them through my website, which they can put the prescriptions in. But like I had a lady yesterday, she's like, I don't do email. I don't know how to use it. I'm like, well, then can you give me the prescriptions over the phone? She's like, yeah, I can get my bottles. Okay, great. So the first thing I'm gonna do is I'm gonna go onto the Medicare Center, just where we were, put her in there, and go ahead and start listing in the prescriptions. So I'll tell them, say, okay, let's look at your prescriptions. We'll put it in there. We'll put all the milligrams. You take your time. And you come back out. I picked one of the medications in there. That didn't help me at all. But you can list in there. All you got to do to add a medication. Was that? I just pulled somebody there.
Yeah. Okay.
That won't save them. But all you got to do on this, you start typing. Oh, atorvastatin. There it is. What's your dosage? Oh, you take 20 milligrams. Is it once a day or twice a day? And you can add a medication pretty quickly. And once you start adding these medications up and you push save, then it's come up with different plans. So then I'm going to ask the client, say, okay, well, who do you see for your primary care doctor? Do you see any other kind of specialists? And I'll go over that. And once I get done, I'll say, well, okay, according to the records, you know, here's a plan that really fits what you're trying to do. And I'll talk to them and say, I can compare these plans, and again, I can email to you, or we can kind of talk about it. And I've had half an hour conversations over the phone with people going over all the specifics of the plans. Well, currently right now, because you can find out what plan they currently have, and on this, but let's say they have that Aetna plan, which compare it with the plan that you think would fit them best. And so now we're comparing it line item by line item, just like you're with them. So I treat them on the phone just like I'm with them and talking through everything. And then once I get done going over the benefits, say, okay, well, this one specials is $10 less what you have, or go over whatever that I think is the better fit for them for that reason. Look, we're saving you about $30 a month on your prescriptions that you currently have. If we do mail order, you can talk them through all that. Now, one of the things I will do right away, especially if I don't know them, I'll ask them if they're getting any extra help. They say, well, I don't know exactly what that means. And I'll kind of explain extra help to them. Everyone knows how to go onto United Healthcare site and check for somebody with extra help, correct?
Yes, sir.
Okay, because you definitely want to do that and make sure that what level of extra help they're on. Because now, let's say they're on 100% extra help or 75% extra help, that may sway what kind of plan that you're going to recommend to them. Because at that point, instead of going on to a WellCare plan, it may have been the Humana PPO plan with the $15 specialist copay. You know, now you look like you're a hero. So once I get done with that, I'll go over and I do go over every single time, even on the phone, and I tell them, I said, look, a lot of times they'll say, that sounds great. It's got dental, it's got vision, it's got over-the-counter benefits, free stuff. It's got gym membership, that's great. And they'll say, what's the catch? And I'll tell them, look, your most expensive part of your plan is going inpatient hospital. That is the most expensive part. I mean, even outpatient hospital, I said, usually it's $200 or $300 for a surgery. That's pretty cheap. You have a $20,000 or $30,000, $40,000 surgery and costs $300 out of your pocket. That's not bad. But inpatient may cost you $2,000. I said, so most of my clients have a hospital indemnity to go along with that to ease their burden of thinking about having to get a $2,000 bill from the hospital.
Ambulance, all kinds of things.
Yeah, so, and I said most of them, and at this point it's a little tough to do home health care over the phone. You can kind of talk about it, but I may just do hospital at that point and say, the hospital plan, you want me to price it out for you? It's probably only about 25 or 30 bucks a month, and that will make sure you don't get that big bill. And normally, I definitely don't want, I was paying more than that before, especially if you save them 30 or 40 bucks a month on their prescriptions and their co-pays. Take that money and add extra coverage.
Now, if their medical is rough, you definitely want to try the home health care and put that hospital in it.
Right. So what Trisha was saying is if they're medically, may not be able to say they're on insulin, they're taking a lot of units of insulin. I had somebody yesterday who was taking 4 different insulins.
Oh.
Yeah, I don't know if that works, but you know that you could not get a hospital indemnity for them, or somebody's been in the hospital in the last year, you can't get a hospital indemnity, so then you definitely want to pitch towards the home health care. You know what, this takes on that money, and, you know, you said you're not married, you know, you live by yourself, let's make sure that you're protected that way, and we can add the hospital indemnity as a rider on that and make sure you get it. But I mean, that's really what I do with the phone, and a lot of times at that point, like, oh yeah, that sounds like a better plan for me. It sounds like a better combination of plans, and you can enroll it right there. And I said, well, I have to send you either a text or an email signature off on that. But again, it's pretty simple at that point. I do almost, I would say, yeah, I'm starting to get close to half my enrollments over the phone. And once you do it a couple of times, it becomes pretty simple. A lot of these people are getting 20, 30 phone calls a day of people that are just doing enrollments over the phone. And you can definitely do it. I did 2 on Friday here for MedSubs. You can do it right over the phone and make it simple, or you can go out and see them, or you do a combination. Sometimes I'll get all the plans, they'll send me all their prescriptions ahead of time. I have them loaded in, so when I go see them, I know it's going to be a 15 or 20 minute appointment. Because now I got the prescriptions, everything's loaded in, I can compare before I go out there. So there's a lot of different ways of doing it. You don't have to. I mean, when it used to be that you had to go to every single appointment and drive everywhere. You don't. You can do it a little bit smarter too, like Matt said. You can have some things already pumped up. Now, if you've never met with them, that may be a little bit more difficult, and I get that. Or if you're going to see them, you can say, I like to get prescriptions ahead of time so I can kind of look at. I mean, there's different ways of doing it. It's just your comfort level of who you're talking to. Now, if you never met with somebody before, you probably want to meet with them first before you do that. But you don't have to be held down to doing one way. Definitely not. And even the ones over the phone. I mean, I had one that was helping me enroll, and then we started talking. Just like, well, I talked to you about life insurance tomorrow. So yeah, you can give me a call. And now it turns into more conversations. So. Or maybe you make them a client, you go back out and see them in January. A lot of what we're doing now, you want to set yourself up to be able to go back in January and February and see these clients. Help them kind of make sure they're getting all their cards in, making sure they've got the over-the-counter items they're ordering, making sure that if they were going to set up mail order prescriptions, you help them go back out there and do that. I mean, that's the full service that we offer. And when you do, that's going to allow you to come back and you're assisting them, and then you can get into the rest of the fact finder you may not have been able to do before because it's a new client. So now you can come back and talk about life insurance, talk about home health care, long-term care, investments. But you definitely want to set yourself up for January and February to be extremely easy. And right now, we are getting ready to get some leads in here, which is great. And we're going to do another lead drop, so we should have some good calling material coming up. The last lead drop we did was 3 weeks ago, so it definitely should be coming in now. But everybody has seen things on TV. Everybody sees all the commercials. They know they need to look at their plans. I mean, the commercials almost scare you sometimes on what's going on. They know they have to sit down with somebody, or at least talk to them on the phone. But you want to set yourself up to be able to come back in January and sit down and talk about things you could not talk about during MA season, because you cannot bring up non-health related products during MA season. So MA time, when you meet with them about the Medicare Advantage, you can talk about hospital indemnity, you can talk about home health care, you can talk about dental and vision, you can talk about long-term care, you can talk anything health related with Medicare Advantage. You can't talk life or investments at that time.
Just to clarify that, I mean, you can
Go back.
you can go back and see them during MA season. You
Sure.
just can't do it on the same appointment.
You cannot do it at the same
Okay,
appointment.
that's what I was gonna ask you.
Yes.
Yeah, you go back, it's supposed to be a 48-hour cool-off time. I got you, Mark.
Okay, 48 hours, got it.
It's supposed to be a 48-hour cool-off time before you go back and be able to market other products to them. So very simple, you see somebody on a Wednesday, wait till next week and you'll do it, and that's fine. Because if they say, I mean, sometimes you're gonna leave a house and they'll say, Patricia, can I talk to you about my life insurance? Or, well, yeah, I can't talk to you about it right now. According to CMS Medicare rules, we cannot do that. But I can make an appointment next week. I'm busy for the next couple of field days. How is next Thursday? Great.
And it doesn't work when the customer tells you to go out of his yard and then come back.
No, do not do that.
I got a customer.
And do not go next door saying, I got a sister who really would love this plan. Don't do that. Have a sister call me.
Yeah.
That'd be good. Mark?
So, I ask this every year, here's the question. Is there any change that we could make in MAPDs where we would not get paid? Not get paid?
If you take a United Healthcare dual that's already on it, and you went there and you switched them to a United Healthcare dual, you would not get paid.
Yeah, I don't know of anything else. I mean, as long as you're going from one plan to another, you're normally gonna become agent of record.
You can't go from the same plan to the new same plan with
No.
the same carrier.
No.
It's gotta be a different plan.
It's very similar. I mean, this happens every year. It's happened about 4 or 5 times this year. Let's say you have a Medicare supplement, somebody has Blue Cross Blue Shield Plan F, and they want Plan G of Blue Cross Blue Shield. Switching them inside the same carrier, you're not gonna get paid.
Except for Aetna and Med Subs, they'll pay you at 90%.
But the question's
Fred
for,
Wadsworth taught me
the
that.
question's not for Med Subs, it's for
Wake up,
MAPD.
Fred.
I know, but I want to put that out there since
Alright.
it has happened this year, and I don't like to see somebody do some work and not be able to get paid on it. So I want to make sure they do know about that too. So yeah.
So you gotta switch a plan within each carrier group to get paid.
Well, yeah, you can't have the same plan. If somebody's on United Healthcare Gold, it's not going to help them go into another United Healthcare Gold. Now, if they went to United Healthcare Choice PPO, then you get paid. It's fine. If you went to the United Healthcare Plan 1 HMO, you get paid. You just can't go from the same plan to the same plan. You're not switching anything. And the reason why she mentioned the duals, because the one dual is kind of going away, they're automatically getting mapped to that anyway.
Yep.
So, for that reason, if you go and write that, it's already gonna be there anyway, so it's essentially a like to like, because yours becomes effective January 1st, it was already gonna be moved January 1st. So that's the only reason. But no, carriers, you go in and find that they're in the wrong plan. You know, somebody is on, I hear this all the time, somebody's on Medicaid and they moved into an HMO plan, and you go help them get back on the Medicaid plan for January, then you're gonna get paid. So, we don't usually run into too much of that. You just can't do the exact same plan. Pretty simple on that one.
Thank you.
Yeah. Any other questions or any other things that I have not really gone over that you have questions on?
Are there any opportunities for like partnering in stores that are available to some of the newer agents? Like we did for Walmart, Walgreens, and all that stuff?
I don't think so, because they've already been put out already, if we're gonna do that. We just didn't coordinate it because there's not as much right now because of all the COVID stuff. I've only seen a couple things that are out there. And then when you do, it becomes pretty restricted at this point. I'll see if there's anything. I've not heard from ASB on that at all. I've only seen it from a couple other people, not much of it at all. So I don't think there's a whole bunch, but I'll look and see. Been fine. Anything else? Well, look for your emails. Like I said, once we get done here, you have all the cheat sheets, all the LIS. If there's anything else I think we're gonna need, we'll add there. John's gonna add all the websites on there, and we should be ready to go come Friday. Again, any questions at all, let me know. Email me, text me, call me. No, because it's not really a list anymore. United Healthcare, you may not have everybody in the state of South Carolina. WellCare pretty much does, so, and that works pretty much.
I think that's pretty much everybody.
Yeah, and I think that once MUSC kind of opened up, I think that kind of became a thing of the past. So I didn't do that now.
On the, what is it, the Humana books?
Oh yeah, hold on.
On the Humana
Oh,
books.
yeah, you're gone. Go.
On the Humana books, it doesn't say what counties, it just says select counties in South Carolina or Georgia, but there's no listing in the book anywhere with the county.
Books that are in my room.
Huh?
And just a heads up, United Healthcare is by quarters 460.
Is it really?
So it's
Over and over and over, okay.
Except for the one that just says MAPD enrollment guide.
It's just good to have that number in there. You can say, well, healthcare is kind of changed. You can say, but United Healthcare is 460.
And I'll get an electronic copy of this too. I'll send it out too. I'll put
Alright,
it
there's
on
a lot of
there.
people, just grab one on your way out.
But it's got all the helper resources that you'll need for the plans. It does have all the plan-specific information in there. It does go over
If
everything.
you're not
So
gonna use one of these, and you're just gonna use his email, there's not enough for everybody, so, like,
I would
I'm
love
just
one.
gonna use the
I would
email
use
that.
it. I would just email it. Not an email.
we're good.
You're not on it.
Redo this.
That's where
Do not forget, Friday is a field day.
I hope so, because I think it's involved.
Well,